For this reason, you have damaged nerves. The nerves or nervous system are a group of cells that specialize in sending signals from the brain to the body. While many people believe that nerve damage is something common only in chronic diseases like diabetes, you may be surprised to know that in reality, nerves can be damaged in various ways, including, for example, after receiving an injury. If this worries you, in this video we will discuss the main signs that your nerves are damaged, which is also known as peripheral neuropathy, as well as the 9 main causes of this and natural ways to correct it. But before we get into it in depth, don't forget to subscribe to our channel and activate notifications to stay up to date with our updates. Symptoms that your nerves are damaged. If your nerves are not working properly, you will most likely have many uncomfortable and even painful sensations that give it away immediately. This happens mainly because the nerves cannot properly carry the signals from the brain to the spinal cord in any case. Next, we will show you the most common symptoms that indicate you are suffering from some type of nerve damage. Number 1. It is very difficult to move some part of your body. When motor nerves are damaged, you may experience muscle weakness or even paralysis. Of course, this problem indicates that we have an underlying condition that needs urgent medical attention. So if you suddenly cannot move a part of your body, the best thing is to go to the emergency room immediately. Things could be more serious if, in addition to the numbness of some extremity of your body, these symptoms are accompanied by sudden confusion, severe headache, and difficulty seeing or walking, because all these symptoms are clear signs that you will suffer a stroke. Number 2. Suddenly you are clumsier than usual. You notice that suddenly you start stumbling and falling very often. Well, this is most likely because of damage to nerves like those in your feet. In some cases, if in addition to stumbling you experience leg cramps, tremors, stiff muscles, and changes in speech, it is most likely that your problem is Parkinson's disease, a condition in which your brain's nerve cells are damaged. Number 3. You go to the bathroom frequently. When nerves are damaged, they can start sending signals to your bladder, so you are likely to feel like you want to go to the bathroom all the time, even when you didn't really need to go, or even have problems going to the bathroom on time. This type of nerve damage is more common if you have diabetes or have given birth naturally. In addition, you may have problems knowing when your bladder is full or trying to empty it. On the other hand, it is important to see your doctor as soon as possible to rule out any possible infection or other underlying disease. Number 4. You sweat very little or too much. If you feel like you don't sweat enough or sweat too much when doing simple physical work, it's very likely that some nerve in charge of transporting information from your brain to the sweat glands is somehow damaged. Due to this damage, your body will be unable to regulate temperature properly. To be sure, your doctor may order you to perform some tests to measure your heart rate and sweating. Number 5. You feel tingling or burning in some part of your body. As we explained at the beginning, when a person suffers from nerve damage, one of the main symptoms they suffer is numbness, burning, or tingling sensation, especially in the feet, hands, arms, and legs. In general, this tingling sensation tends to disappear after a while. However, if the numbness persists, it is best to see your doctor immediately to get checked out soon. Number 6. You have pain in one leg. If the tingling, burning, or sharp pain begins from the lower back and descends to the back of your leg, then most likely you suffer from sciatica. This occurs when the sciatic nerve, which extends from the back to the leg, is compressed either by a disease like diabetes, a strong blow, or a herniated disc in the spine. Number 7. You suffer injuries without realizing it. Sensory nerves are responsible for warning your brain that you are touching a dangerous surface so that you remove that part of your skin or body that is being damaged before suffering more serious consequences. However, when your sensory nerves are not working properly, this emergency signal may not warn your brain in time, which leads to you suffering injuries without you even realizing it until later. Therefore, if you suffer from bruises, cuts, or burns on your tongue or part of your body that you did not notice from touching something sharp or hot, it is most likely that you suffer from some form of nerve damage and should have your doctor check you out soon. Number 8. You suffer from intense headaches. If you have short but very intense headaches that happen often, it is most likely that you have something known as occipital neuralgia, a condition that can develop when a nerve in the neck is pinched in some way. You will probably need a nerve block, which consists of an injection that temporarily blocks the nerve that is giving you problems so that you no longer feel pain in that area. 9. Causes of damaged nerves. Now that we already know the main symptoms of damage to your nerves or peripheral neuropathy, let's look at the 9 main causes that cause them. Number 1. Some disease. The vast majority of nerve damage is due to a complication or symptom derived from some underlying condition or disease. These diseases include diabetes, multiple sclerosis, multiple myeloma, and the wide variety of different types of cancer. In fact, it is known that diabetes is responsible for 30% of cases of nerve damage in the world. People with diabetes who suffer from nerve damage usually suffer from numbness, loss of skin sensitivity followed by burning, pain and stinging in the extremities, especially the fingers. Another disease known to damage your nerves is trigeminal neuralgia, also known as tic douloureux, which causes horrible pain on the side of the face. The most terrifying thing about this condition is that it can occur for no reason, and it is one of the most common neuropathic pains. Number 2. Due to infection. Shingles or herpes zoster is one of the infections that can damage your nerves and cause several weeks of neuropathic pain. In some cases, shingles can be complicated by post-herpetic neuralgia, in which the nerve damage is greater and therefore the pain as well. Syphilis is another infection that can damage your nerves and cause unbearable stabbing, burning pain. Number 3. Due to injuries. Sometimes injuries to your joints, muscles, and tissues of your body can cause damage to your nerves and cause pain. Of these injuries, leg, hip, or back injuries are the most dangerous as they can cause permanent damage to your nerves. The same goes for spinal injuries, because herniated discs and the compression they apply to the spinal cord can damage the nerve fibers around your spine. Number 4. Loss of limb. One of the most common ways in which your nerves can be damaged is by losing a limb, specifically by a neuropathic pain known as phantom limb syndrome. In this syndrome, the brain of people believes that the missing limb still exists, so it continues to receive pain signals from that body part that no longer has it. However, what is really happening is that the nerves near the missing limb are failing and sending erroneous signals to the brain. In addition to complete limbs, phantom pain from atrophied nerves can come from your hands, feet, and fingers, and even from your ears. Number 5. Vitamin B deficiency. Vitamin B deficiency is also known to damage nerves. While this deficiency is very rare, it is more likely to happen to certain people such as pregnant women and the elderly, as they need greater amounts of vitamin B than other people to avoid complications. Number 6. Hypothyroidism. Hypothyroidism is a disease in which your thyroid gland fails to produce enough thyroid hormones, and although it is very rare, it can damage your nervous system and cause peripheral neuropathy when the disease is severe and lasts a long time. Peripheral neuropathy refers to the damage caused to the peripheral nerves, which are responsible for carrying information from the brain and spinal cord to the rest of the body and extremities. Nerve damage is more common in the wrists, although it can attack any part of the body. Number 7. Spinal arthritis. Spinal arthritis is caused by a gradual wearing away of cartilage in the facet joints, which allow the vertebrae that make up the spine to bend and extend. Thanks to this wear, the cartilage begins to break down and become inflamed, which causes pressure on the adjacent nerves. Number 8. Carpal tunnel syndrome. This condition is caused by extreme pressure on the median nerve, which is a nerve located in your wrist that provides sensitivity and movement to the various parts of your hand. The damage to this nerve caused in those suffering from carpal tunnel syndrome usually causes tingling, numbness, weakness, and muscle damage in the fingers and hand. Number 9. Facial nerve disorders. Facial nerve disorders can affect the nerves in the face to the point of causing weakness or paralysis on one or both sides of your face. This means that you will lose the ability to make facial expressions on the affected side, leaving your face in a fixed position with no expression. In some cases, people may suffer from unusual muscle contractions and other tics or involuntary movements in the face. How to treat damaged nerves naturally. Fortunately, there are several natural treatments available to counteract nerve damage. Although to some extent and depending on the case, it is important to clarify that you should talk to your doctor before taking any of the natural treatments exposed here. Some of the most common natural treatments include topical creams with capsaicin, an ingredient found in some hot peppers. Thanks to these creams, the intensity of the pain signals sent by the damaged nerves in the body can be reduced. The benefits of capsaicin for treating nerve damage can also be obtained by including cayenne pepper in your daily diet or by taking a supplement with this ingredient. Regular exercise has also been shown to be effective in treating pain caused by damaged nerves. Additionally, being active can lower blood sugar, which is known to damage your nervous system. Similarly, meditation can help you relax and improve your coping skills to decrease the intensity of pain caused by atrophied nerves. A warm bath can also relax your muscles and relieve the pain of neuropathy, as this water improves circulation throughout the body and reduces pain caused by numbness in some parts of the body due to poorly functioning nerves. However, be careful not to overheat the water or you will have the opposite effect. Quitting smoking will improve your blood circulation and decrease the pain and numbness caused by damaged nerves in the body, among other positive changes for your body. Taking supplements with vitamin B or C foods or supplements also avoid or decrease the risk of nerve damage due to a deficiency of these vitamins. Finally, acupuncture can improve your body's ability to activate and heal the damage caused to your nervous system and thus decrease the pain related to it. How is neuropathy or damaged nerves treated? The most common medical treatments used to treat pain caused by damaged nerves include topical analgesics. Your doctor is very likely to prescribe certain topical analgesics such as capsaicin patches and lidocaine, as well as some over-the-counter ointments or creams. On the other hand, there are some non-steroidal anti-inflammatory drugs that can help relieve pain caused by compromised nerves. However, many people find that these medications are not very effective in treating their neuropathic pain. Antidepressants. Some antidepressant medications such as tricyclics and serotonin and norepinephrine reuptake inhibitors have been shown to provide good results for the treatment of pain and other symptoms associated with nerve damage. Nerve blocks. Your doctor may also prescribe injecting local anesthetics or steroids into the nerves believed to be sending defective signals to the brain that are causing pain. These injections will cause those nerves to become blocked, stopping them from sending signals to your brain and relieving the resulting pain. Other treatments. Other effective treatments for combating damaged nerves include anticonvulsant medications such as gabapentinoids or implanting a device in your body, specifically in the spine or brain. Once placed, this device will stop the nerve signals and regulate them to control symptoms. However, it is used as a last resort when other treatments do not produce the expected results. Finally, we have the lifestyle changes and physical and relaxation therapies mentioned earlier in the natural treatments. Now you already know how to detect if you have peripheral neuropathy, the reasons and main treatments for this problem. If you think your nerves are damaged, remember it is very important to talk to your doctor to confirm your suspicions and take the most appropriate treatment for you. We hope this video has been helpful to you. If you have anything to add, please share it with us in the comments section. Like this video and send the link to your family and best friends so they also know what are the reasons why they have damaged nerves and how to repair them. If you are new to our channel, don't forget to subscribe and follow us on all our social networks that will be here below in the description. Remember, life is always better taking care of your health.